Welcome to the DIPIN Steering Committee orientation. This session is What is DIPIN? So DIPIN, or the Diabetes Impact Project Indianapolis Neighborhoods, was initially a 5-year project funded by Eli Lilly Company through their Global Health Partnership to help address those that have diabetes, to help them get under control, to help keep people from getting diabetes, and to help identify those that are at risk to be able to change those risk factors so they do not get diabetes. Originally was a $7 million project and was extended when the project was extended to a total of 8 years. So it now goes through 2026. The project is focused on community engagement, working with 3 neighborhoods in the Indianapolis area. So why did we want to do DIPIN? We know that the worldwide estimate for diabetes is over 8%, and yet in some of our neighborhoods in the Indianapolis area, we have diabetes levels as high as 15 to 21%. We felt that there was a need to focus on ways to prevent those help prevent people from getting diabetes, and also help those that have diabetes to be able to successfully keep their diabetes under control. And the concept of where you live shouldn't determine how long you live was also influential in getting the project started. The DIPIN project has these 4 aims: improving access and continuity of care for people with diabetes, increasing screening-seeking behaviors for those that are at high risk, to help foster an environment that includes both the physical and social environment that supports diabetes control and prevention and overall healthy lifestyle, and to increase community capacity in our DIPIN neighborhoods through a focus on community engagement and increasing community leadership. So aim 1, reducing complications and improving quality of life of those with diabetes. Our primary partner is Eskenazi Health. Eskenazi has 3 federally qualified community health centers that are located near each of the 3 neighborhoods. So we're working with the Blackburn Clinic, the Forest Manor Clinic, and the West Side Clinic. We also over time have taken clients from the West 38th Street and Arlington sites, as those clinics also see people within the DIPIN neighborhood zip codes. This particular intervention is to have the community health workers work with those diabetics that have blood sugar levels, their hemoglobin A1C, which are higher than normal, and that can cause long-term complications if those levels stay too high. So the community health workers work with those clients to help support them in identifying what are barriers that are keeping them from being able to control their blood sugar, and that includes focusing on their social determinants of health. So far, we're back again to 6 community health workers, and they have enrolled over 400 clients during the time of the project. Aim 2 is increasing awareness of risk factors for diabetes and encouraging people to change those factors, and also to be screened so they know that they are at risk. Our primary partner is the Local Initiative Support Corporation, or LISC, and 3 neighborhood organizations that the steering committees helped to identify and selected to be our to house the neighborhood community health workers. So they are the Flanner House, United Northeast Community Development Corporation, and the Christmore House. The intervention with the neighborhood community health workers is to increase resources that can be brought to bear to help, again, decrease risk of diabetes, increase awareness of diabetes and those things that can help prevent people from becoming diabetic, and screening for those risk factors. Also includes networking and providing education in the community, and working closely with the steering committees to help address and identify opportunities and challenges to being able to reach this aim. So far, they've completed over 184 diabetes screenings. They've hosted over 148 community events and reached over 4,344 people. Aim 3, then, fostering an environment, physical and social, that supports greater health and well-being for all residents. Our primary partners are our steering committee, local residents and organizations. And they've been involved with helping to help us gather data, helping us identify from that data potential needs. The first data was collected through a randomized household survey. We also collected other local data. That information was all summarized into an infographic and presented to the steering committees, and they then selected 3 primary prevention focus areas. These particular strategies will help to address policies, systems, and environmental changes that can help to, again, keep the environment healthier, keep people from getting diabetes. And the 3 primary prevention focus areas are decreasing barriers to physical activity. That's for the near northwest. The near west picked decreasing stress, and the northeast picked decreasing barriers to good, healthy food access. So the evaluation of these particular efforts are coming through the proposals that have been approved to address these different needs. And each proposal has individual evaluation methods and data that they are collecting to be able to see if we are addressing these particular needs. So some of the things that we've done so far, we spent a lot of time just in relationship building, helping to establish the steering committees and the guiding principles. Each steering committee has their own unique guiding principles, and those are updated regularly. We spent a lot of time helping to develop partnerships with other organizations. We don't want the project to duplicate efforts. We want it to fill in where there are gaps in needs. I spent a lot of time, again, working with Eskenazi Health to incorporate the community health worker into their medical record, so we could use that to evaluate the intervention with the Eskenazi community health workers. We've also spent a lot of time with our Marion County Public Health Department partnership. One of the recent proposals that each area is working on is looking at nutrition and providing healthy food information, as well as access to other kind of recipes and food demonstrations. We did hold an annual meeting after our first year with over 100 attendees, and that included working with some Lilly Global Health fellows that were in the area before that meeting. The first community survey collected information from over 1,000 respondents. Our second community survey is being done this spring of 2022. We also did key informant interviews at baseline, and those will be ongoing to get input from residents. We have a website that's been developed by one of our partners, and that data is available for you to help assist in writing grants or other projects. We also have had a few early successes, which included our community health workers at Eskenazi helping clients through a wide variety of issues. Some have been faced with homelessness or issues with domestic violence, and they've helped move them to safer housing situations. They've been providing education about diabetes. Some of the folks have had to be assisted in getting glucose monitors so they could regularly check their blood sugar. One of our areas had been identified as a food swamp and was successful in preventing another fast food company from coming in, and instead got a different business to move in. So we've had a variety of different aspects, and certainly proposals have been approved and have been ongoing in each of the areas. Here's a list of, again, of the different partners that we work with. So this concludes the presentation of the overview of what is DIPN. Thank you for your time. If you have additional questions, please contact me or other DIPN team members. Thank you.